Welcome back to Taival Outdoors. My name is Joel and today we are taking a look at my first aid kit, and specifically a kit that I carry when I go backpacking or hiking. And as you can probably tell by the size of this thing, it's a bit bigger and dare I say a bit more advanced than what I see most people carrying outdoors. And if you're only interested in the actual contents of this pouch, then please feel free to jump ahead. I have, as always, video chapters and timestamps down below. But before going into the actual items that I have inside of this pouch, I would first like to talk a bit about why I carry my first aid gear in this kind of setup, in this kind of pouch, because there is a very specific reason for it, or actually a couple of reasons. And while I'm not saying that my way is the only right way of doing things, I still think that I have figured out something that many of you who are actively going outdoors, hiking, backpacking, and so forth, should consider when thinking about your own first aid kit, and especially the placement and how you carry it. The pouch itself is not that important. This is some no-name Chinese brand, sort of tactical looking pouch that I got from an airsoft store. And just to be absolutely clear, although it is green, this is not some type of a military trauma kit or anything like that. This is specifically, or at least I built this specifically for backpacking uses. I do have my chest rig here and separate IFAK in this, and the contents of this IFAK as well as the materials are made for combat use, and they are very different from what we are going to go through today with this. Just because this is green and I got it from an airsoft store doesn't mean anything. It's green because my backpack is green, that's it. But the form factor is important here. As you can see, there's a big handle up top and the backside is made of hook Velcro. The reason for that is I carry this kit on my rucksack's waist belt. So of course the Velcro attaches to this MOLLE compatible faceplate, and then there is an additional strap and a clip to secure everything in place. This placement has two key benefits. First of them being, of course, that you might want to have a quick access to your first aid stuff. Although this does include a pressure bandage, this is not really a trauma kit, but if it comes down to it, I think you should have quick access to your first aid stuff instead of trying to go through your rucksack and trying to find where is your kit and so forth. So when the time comes, just unclip the buckle, grab the handle, and the kit is ready to be used. And also, if your friend is having a trouble and you're kind of responsible for the first aid stuff, as I tend to be, this is then easy to just tear away and throw to a friend or a partner who might need the contents. Pouches like this are usually called tear away or rip away, tear off pouches. They all have that kind of MOLLE compatible pack panel and then the pouch itself. This had also some pass webbing and stuff like that, but I cut everything away. So the first major benefit of a form factor like this is the ease of access, quick access to it. But the second one is something that I don't hear talked about a lot, and that is if you travel in a group and something happens to you and you might go unconscious or be in some kind of disoriented state, it's very nice that your first aid kit is somewhere that is also accessible and easily located by your friends. So it's not buried inside your rucksack, but it's right there in the open, quite visible. That is why I added this red 550 cord to the handle, as well as these pull tabs. And this little medic patch here actually reflects all light, so it's easier to locate this pouch in the dark, and it has kind of white linings around that red cross, and those actually glow in the dark. So again, I want this to be easily identifiable and easy to be found even in low light or dark conditions. So even though it's green, the purpose of it is to be as visible as possible, I guess. So of course, when embarking on a journey, you should tell your friends where your first aid stuff is. And in my case, I always carry this in the same place, left side, the waist belt of the rucksack. And even if my friends wouldn't remember what I said, like where I'm keeping my first aid kit, it's completely visible all the time. So they will be seeing it throughout the trip and kind of having that mental picture inside their head that, okay, that's where the pouch is, always in the same place. So easy to access for everyone in your group. And that is also one of the reasons why this is a bit larger kit. I tend to have a bit of a responsibility when it comes to first aid stuff if I travel with my friends or my family. I'm not any type of wilderness medical professional by any means, but I built this kit in a way that there's nothing inside here which I wouldn't know when and how to use. And I think that is very important. So while there might be some stuff that not all of my friends or hiking partners might know what they are for, the basics are then of course accessible for everyone, and rest of it at least accessible for me. I guess that's everything about the pouch and form factor itself. But before going on by the table and me showing you the exact contents of this kit, I would like to say that there's actually 2 other pieces of gear that I count as first aid stuff as well. And after I've shown everything that's inside here, I will show those 2 that I carry almost every time I go outdoors with me, that are something that lives outside of this kit, because neither of them can fit inside, and you see what I mean then when I go through them. But anyway, let's go to the stage that you all been waiting for, or at least opened this video for. So let's look at the contents of this kit. By the way, this kind of setup is not a new thing for me. This is my old first aid kit, which has exactly the same form factor. It's a bit smaller, especially now that there isn't anything inside of it, but I used this setup for years and years and years and couldn't figure out anything better, to be honest. So I upgraded to a bit bigger kit, and let's take a look what is inside. What my old pouch didn't have was this third mesh or net section here, and that is actually one of the main reasons that I went with a bit bigger pouch. But I guess we could start from the left, kind of the back side of this pouch. Squeezed in here are some adhesive dressings, few different sizes, nothing fancy, as well as soft dressing as well, 10 by 10 centimeters, couple of dressing pads, never hurt anyone. And here's also one of the most important things and why this kit looks so big when put together. I have a field guide of wilderness and rescue medicine, and as you can see, this is pretty extensive. Let's see, 100 pages or so. And this is a field guide version of this book, which was kind of the course book for the medical training that I went through last year. And as medical skills are perishable skills, especially if you're not doing this on day-to-day basis, they're recommended that you would read this book through once a year, and then once a year the little one. And I have to confess, I haven't read the big one yet again, but I've read this a bunch of times when I'm backpacking. And so this is also, if you have nothing else to do around the camp, it's something to read and kind of figure out how some basics go in case you've forgotten. So quite extensive, but something that I'm very happy now to have in my kit. Then there's some first aid for burns, bit of like a cooling gel, I guess. Now, of course, this is not super relevant during winter when there's plenty of snow to go around for you to stick your hand into in case you got a burn from a pot or stove or fire and so on. But during summer, if you happen to be on some kind of a stretch where there isn't any lakes or ponds or so forth nearby, and you don't want to just pour your drinking water on your burn, then this is really nice to have. Also can be helpful for insect bites, or if you brush your legs or hands against some plants, nettle and so forth, where you might get a bit of an itch. This might help. Then some hand sanitizer, also works as a fire starter extremely well actually for that. Tweezers, these are great for taking and picking away ticks and splinters, for example. And here in this bag I have actually a smaller bottle of betadine. This can be mixed with water to create quite a lot of disinfectant that can be then put on top of any wound or so using this. So that is why I have this thing in the kit as well. Again, something that is a bit bigger and probably not in everyone's kit. And honestly, this combination, I'm sure you could live without, and it takes a lot of space, but I do have the space in this pouch. And as this pouch lives outside of my rack, I don't have to worry about how much it takes space away from my food or clothing or other camping items. Then safety pin and this thing to hold together this just gauze. I've added a bit of elastic loop through the drainage hole to keep this in place. Then moving on, I have some more gauze. I guess you can never have enough. This is just compressed, usable for everything that's gauze is usable, but also for wound packing. Nice to have a bit of an extra. Triangular bandage. Yes, I know you can improvise these things using shemagh or whatnot, your t-shirts and so forth, but again, I have the space. This doesn't weigh anything at all, so why not have the actual thing? Some gloves from North American Rescue, bear gloves. These are really nice. Again, I added a bit of a loop to hold everything in place. Back here, Leukotape, and of course something that most people consider to be their first aid kit, which is just some band-aids. It's good to remember the basics, although you might have a bit more advanced kit when you go out. Sharp scissors, really useful, cutting up the Leukotape or whatnot. I guess this is called a tick lasso, so in case you don't want or can't pull a tick out with tweezers, this is also a good option for that. Some chapstick with SPF 30 protection against sun, really useful throughout the year. And then, as I mentioned, I do have a trauma dressing here, 4-inch hemorrhage control bandage. Nice thing about these packages is that even if you wouldn't be trained to use these, which I am, they do come with instructions on the other side. Again, if someone else has to use this kit and use this on yourself, and maybe you cannot help them in that situation, then at least there's some instructions also here. And then moving to this final section. So here I have hydrocortisone. This is antibiotic ointment, and to go with both of those, there's also a bit of Burt's Bees hand salve, which I've actually mixed with pine resin, kind of a salve or ointment as well, which was made in Finland, handmade in Finland, and this is a mixture, like a 50-50 mixture of both. Good option as well. And then rest of these are just over-the-counter medication. I've added little bits of text for each of these. For example, this is ibuprofen, and the strength of the drug, paracetamol, same thing here. You cannot actually see it with these two notes, but there is also dosage and expiration dates, but it's folded there in. I should make new ones. For example, this is Precosa, whatever. Dosage information included there, as well as expiration date. Imodium, pretty self-explanatory. Same thing here. This is some antihistamine. Again, dosage, how much, how many, expiration date, and then the actual item in there. And because I'm sure that at least Finns will ask about it, yes, I am carrying Ky-pakkaus. This is basically, again, hydrocortisone. This has a bit of a mixed reputation in Finland because Ky-pakkaus basically means that this would help if the only poisonous snake in Finland would bite you. The thing is that the snake itself isn't really that poisonous. But for example, if I would be out there with someone who got bitten by that snake and would maybe panic a bit because of that, at least I would have these to give them and you know, make them feel better at least. There's again how to use these in case you get bitten by this snake or in case a bee or a wasp stings you. Yes, I do not have EpiPen. I would like to have that, but that is prescription only, and because there is no that type of allergic reactions being in my family, we don't have the prescription for EpiPen, but this is the kind of the next best thing that I can get my hands on, let's say it like that. So here is everything. I don't think this is super special, but I think it is more than most people carry. And I'm pretty happy with this kit as it is. It covers all of the common situations that myself or the group that I'm with might encounter when out there. But two things that are missing that I mentioned that I also carry with me. Let's look at those next. First one being, of course, a tourniquet. This is my Hill People Gear kit bag, and underneath I do carry cat tourniquet, which is the tourniquet that I'm most familiar with, most practice with. And this pouch is again something that I can just pull open with either of my arms and deploy the tourniquet in a quite quick fashion. So yes, I do carry a tourniquet with me, but it's probably a wise thing to keep your tourniquet somewhere else than inside your first aid kit, just to have it as quickly available as possible. The next big thing is this. This is a sitting pad that I made, or sitting pad sleeve rather. And inside of this is the biggest available SAM splint. I did a little origami work and folded this over, but basically this is splinting material that you can bend in whichever ways. This is quite wide and very long as well, so it is usable for leg injuries too. So it's not just for your wrists or twisted ankles, but oops, sorry about that, twisted ankles, but also if you do have kind of fracture or something in your leg, this might be useful for that as well. If you cannot use this alone, at least it's a very good start that you can then complement with the skills that you get from first aid training, and of course the instructions in here. And then you would just cut down a few saplings or something, some type of wood, and then bind it all together using your gauze or whatever. So something that I keep with me, and it travels quite handily in this sleeve. Splinting material and a tourniquet, and then everything inside here. So there you have it. This is my advanced outdoor first aid kit, and you also saw the other components of my first aid setup that I carry with me when hiking or backpacking and so forth. Let me know down in the comments, what do you think about the whole setup and the kit itself, the contents, and especially if I have maybe overlooked something that or forgotten something important, please let me know. I'm always eager and interested to perfect this setup. Of course, considering the skill set that I have, I'm not going to carry some super advanced medical equipment just because it's cool, but I need to be able to use those items, and these at least I definitely can. So there you have it. My name is Joel. You've been watching Taival Outdoors, and I will see you all in the next one.